So, this is my experience with radiotherapy for the treatment of Ledderhose disease in the UK. I was treated at the Royal Surrey County Hospital under the guidance of Dr. Shaffer, and this is sort of part 2 of my Ledderhose disease story, as I've previously posted about this before. And just for a bit of clarification, I'm a 25-year-old male. So, as I mentioned, I posted before, and there I discussed my experience with steroid injections, which was okay, the use of orthotics, and also how I didn't want to have surgery because there's lots of problems, side effects, and it frequently comes back. So, just a quick mention that Ledderhose disease is sort of a lump or a tumour in the arch of the foot, and it occurs in the plantar fascia, and the idea here is to give it a zap with some radiation. So I initially went for a consultation, this was a free consultation, and actually got in contact with him through the British Pediatric Society, and we met at the hospital in Surrey. We discussed and evaluated my condition and agreed that radiotherapy was the right option for me. We also then went through all the different risk factors such as smoking and drinking and diabetes and epilepsy, actually none of which I have, and the only thing I've got against me is that I'm male, but I'm well below the average age group for this, which is about 50. I guess just unfortunate, I must have had some trauma to my foot potentially that caused this. On the cost side of things, there was talk of me going to Germany at one point, but it's sort of figured for convenience, and actually cost was probably about the same, even though it's actually cheaper for the treatment with travel and accommodation and food that would have been required to get to Germany. It probably would have worked out more expensive. But for anyone getting more than one extremity done, it might be worthwhile going to Germany for the cost side of things, and they do have slightly more experience, though Dr. Schaffer was excellent. So, quick run through what happened on the day. It's basically turned up and parked, saw Dr. Schaffer on the first day of radiotherapy as well, then introduced to the rest of the team, then had to go in and have a quick setup section, went away for about half hour, then came back, had the radiotherapy, which 4 or 5 minutes, and then had to sort of come back every day for the rest of that week, and then another week and 8 weeks later. So actually turning up and parking, as radiotherapy for Ledderhose is not available in the NHS, annoyingly, I had to pay for this privately, and as a result I was given a parking permit. I don't know if this is given to all patients, and it was actually right outside the building, so that was quite useful. Dr. Schaffer met me about 5 minutes after appointment was due to start, which perfectly acceptable given that, say, for one NHS appointment I actually was 2 hours late seeing the doctor. So the meeting with Dr. Schaffer, we went through everything and discussed the treatment, how it's going to go. He then sort of felt along the bottom of my foot to find where sort of the lump in the arch was. He then sort of drew round the lump, which is shown in the bottom picture here. The inner circle is showing sort of the outline of the lump, and the outer circle is showing sort of the area to be radiated. So to zoom in on this to show, it's the outer lump actually is sort of a margin, so you want to make sure you get the entire area where the disease is present, and the way that this is done is to give this sort of safety margin around the outside. So I was then handed over to the rest of the team. The rest of the team were very helpful, and we discussed many different things. So they again went through the treatment and exactly how it was all going to happen. They also went through post-treatment care, so the skin typically dries out after radiation, so it's recommended using E45. Also explained that it can sort of flare up a little bit in sort of couple of weeks after the treatment, and they were all very professional, very helpful, and they were happy to chat with me, and I was never sort of not knowing what was happening. So for the radiotherapy to take place, there was a lead plate produced, which effectively the inner circle of this went around the outer circle on the bottom of my foot, so there was then protection for the rest of my foot. The machine then shown in this picture was then basically clamped onto that lead plate, and the radiation beam sort of comes out of the center of this and then just hits the area with the presence of the diseased tissue. I was only laying down for about 5 minutes and quite happy for me to play on my phone, and yeah, obviously no pain and no side effects at all during the initial week of treatment. And I then obviously say had that week, that was fine. I went back for the second week, that was fine, and actually I've made good progress. So I've gone from barely being able to walk to being able to walk a good 20 minutes pain-free, and probably about at least for an hour in the course of a single day where I can walk and I'm pretty much pain-free. The only side effect I've had really is dryness in the bottom of my feet, well, the treated foot. And it's sort of see from these pictures. The picture on the left shows sort of a really dark dry patch, and the one on the right just shows the dried out skin. E45 does help to clear it up, just remembering to apply it. And so I can apply it for a week and then forget to apply it for a week and it will come back. So at the moment I'm continuously trying to treat with E45 until this completely clears up. But other than that, I haven't had any side effects after this treatment. Overall, obviously, do what your doctor says, but for me personally, I feel that radiotherapy is really good treatment for Ledderhose disease. I feel that it has huge advantages over surgery. The biggest problem obviously is the cost. It is very expensive, bearing in mind that other treatments are available in the NHS for free. I would say do try orthotics. They could help you, and obviously completely non-invasive. And if you have surgery, you're likely to need orthotics anyway, so it's worthwhile trying them.